Assalamu alaikum. Thank you for joining us today at ICNA for Social Justice, Council for Social Justice. I have here today my friend Moghitha Alhaassan-Alkibisi. She's a certified counselor with Fairfax County Public Health. Yes. Moghitha actually was born in Yemen, and she graduated from George Mason University with a master's degree in counseling and development. She's a mental health clinician and therapist with Fairfax County. She has been in the Fairfax County since 1997. Moghitha is also a steering committee member with the Interfaith Community for Dialogue. Assalamu alaikum, Moghitha. How are you?
Alaikum assalam. Thank you for inviting me.
Thank you for coming. So mental health is a really, tough question in our communities. There's a lot of stigma around it.
Sure.
So we're trying to answer some questions going around. It's like everybody is asking these questions. Maybe they're too afraid to ask it or talk about it. So we try to tackle some of these questions.
Right.
Thank you. So the first question is, what is mental health?
Mental health is an illness. We all have to understand that the brain is an organ like the kidneys and the liver and the heart. So when the brain gets sick, which is a malfunction in the way the brain chemistry communicates with the rest of the body. That's what would show us mental illnesses, and when a person appears they're malfunctioning or they're not acting like the rest of us. I don't want to say abnormal because sometimes they act pretty normal, but they are suffering from inside, and we don't see it. But mental illness is a serious illness, and it's in an organ within our body that we have to really recognize and educate ourselves about.
Anyone can suffer from mental illness, correct?
Sure. Nobody is free from a little bit of mental illness. If you go into the DSM-4, which is the book that has all the diagnoses of mental illnesses, 100% pure brain of mental illness or free of mental illness is practically non-existent. You would have to have some anxiety, some issues, you would panic when you go through a test, sleep issues. We all have a little bit of, we're not perfect. Yes, so some kind of mental illness was definitely.
So what is, right.
Go ahead.
So why is it important to educate ourselves on mental health?
It's so important, especially in our community. There's a lot of stigma regarding mental illness. People hide it when they have it. People hide their family member if they have mental illness because it's known to be jinan, or God had given you this illness because you're not a good person, or you have your brain has jinn in it, or somebody has played some kind of magic on you. So it's thought of as something that's really bad. It's looked at as a bad illness, just like it's unmentioned. Like when people have cancer, they say they have that illness. So mental illness is definitely something we really have to educate ourselves about and tell people that it's an organ and it gets sick just like the rest of the human organs.
You think the family, especially the family of the person who has diagnosed with a mental illness, has to know like how to deal with that person and educate themselves about the type of illness and what is the symptoms and how it's going on.
Of course, the family is the most important component in treatment of that individual, and there have been tests and studies that say that the person, including mental illness, the second most important thing is the family support. If the person feels supported, understood, and guided, and understood, we understand what you're having. you're not alone. You know, this is basic. This is essential to any kind of family and any kind of mental illness or any physical illness for that matter.
Okay. So what is the top, like, 3 type of mental illness you think our community is going through, or like the people who come to the United States?
Absolutely. Well, newcomers have something called adjustment disorder, which is they suffer with anxiety and a lot of depression. They feel because they are faced with new issues, new society, new language, new bills, new requirements and laws, and so they get sometimes to they develop panic attacks. But this is not supposed to last more than 6 months. If the depression and anxiety last more than 6 months, then the person has to seek longer term treatment. But adjustment disorder is definitely there, and it hits everyone that comes to the U.S. or any other different community for that matter. And so most newcomers suffer that.
How about any other mental health issues?
And mental health issues in our community, we're all newcomers. I mean, we're all refugees from another world, so we are here for one reason or another. Basically, a lot of people will have PTSD. PTSD means post-traumatic stress disorder. Everyone suffers from that because we suffered like war issues, fear, discrimination here or from the places we escaped from. So that's the second one. So adjustment disorder and PTSD, and then of course anxiety is a huge umbrella, and under that it's we have a lot of components. From that we develop fear, suspicion. Personality disorders are many. From that we have borderline personality disorder, which is most of the personality disorders are the reason for them would be mostly genetic, but the second most important reason is environmental, which means they were abused as children. And when you're abused as children, if you're abandoned, if you're physically, emotionally, mentally abused, then you would develop a personality disorder, which makes a person have a bleak outlook on life. They don't trust people. They have a lot of issues, dysfunctioning issues with others in their work environment, in their school environment, in their family and social environment. So that's the other mental illness that we have to deal with, because beating is normal in our society. So so personality disorder gets developed. And the other one is also we have schizophrenia, because we're humans like the rest of the world, and so people do develop mental illness, which is an organic mental illness. So that's another issue that we develop. So yes.
How about our teens, like the teens in our society, especially coming from a different background? Like I know, like from your experience, you've been working for a long time with people who has family coming from different culture, who came to the United States, and then they asking their kids, like to be this, people like back home or whatever they come from, and then what do you see in the Muslim teens or in the community?
First of all, our teens are very sensitive people, and the most important thing to them is to belong. Is to belong to their to the peer group and to be part of this society, and they really feel like this is where I belong. I like it because the school they are taught by teachers who have studied the ways and communication, the ways, and so everything seems kind and beautiful and easy to deal with, and the way people dress up and the fun factors in the school environment, and then they come home and their parents yell at them from the moment they get into the house. Why are you dressed like this? Why do you look like this? Why don't you know? Go and pray. And so they develop this negative attitude towards coming home. And so their issue would be either being extremely defiant, or they totally don't want to have anything to do with their families, and they're ashamed because our families are not as fun, and they're old-fashioned, and they don't understand us. This is a basic thing for the teenagers. And so they would develop defiance, and they would develop, like the rest of the teenagers in the world, if they feel they don't belong, then they would be depressed, and then God forbid, there is a lot of statistics these days that there's a lot of suicide taking place. And I'm hoping that if we have a strong religious value that's being transmitted, imparted to our kids, to have them value our religion in a very comforting, warm and home environment, to make them feel like there's nothing to be ashamed of, to show them that we understand, we speak the language, we understand teens, we understand that they must have friends, and they must have some dress, but we can tell them, you know, you can pray, but it's good also for your soul. It's an exercise. It makes you clean. You know, make the religion look welcoming and embracing. This way they will be, you know, proud of their heritage, and they would welcome it. So those are the issues, I think, that are important to look at as far as looking at our teens.
As a college student, a lot of what you mentioned, I've witnessed myself.
Okay.
And what I hear in my my circles and around me and everything in college is that people who are depressed, who have anxiety, who confide in their parents or their families, most of the time their parents just say, "Oh, you just need to pray more," or "Oh, you just need to start reading Quran," or something like that, instead of actually like talking about their issues and trying to seek help for them. So how would you, what would you say to them to help, or how would you tell them to go about this way?
Very important question. The teenagers don't want to be told you just have to pray, just like adults. Like I know, like people who are abused, they go to mosques, and they're told, like abused wives go to mosques, and they tell the sheikh, I'm abused, and they would tell them, you're not praying more, you're not fixing your husband's dinners, you're not dressing up for him. You know, somebody who's hurt physically or emotionally, they don't want to hear these things. They want to be understood. They want to be told that we know that you're going through this, and let's work this problem together. I don't know if that answers your question. Yeah. Yes?
Kind of. More as of like, how could these people, or like the younger generation, talk to their parents in such a way that they actually get help, instead of just being told that like they need to pray, or like for the parents, how can they deal with their children in a more helpful way?
Right.
The resources also, like you know, like how to reach resources.
Exactly.
I know there's resources in school, there's resources in community. I know you've been working in one of these resources.
Right. Teenagers and young adults don't necessarily respect what their parents tell them, even if their parents are professionals. They know how to respond. Their words don't have that much weight or value. So what I would recommend is that they refer them, you know, go talk to a professional. If you have a real serious issue, then they should refer them to outside professionals, you know. Of course, embrace their issue, tell them we understand you, but I may not be the best person to advise you, so they should refer them out.
And so I guess going off of that, how could friends be allies to friends who have mental health issues? What are some ways and techniques and stuff?
Support. I'm with you, I'm here with you, I support you, I understand you. I know you're not alone. These are all words that are important in providing support to your friends.
So we kind of touched this, but we need to talk about it a little bit deeper,
Mhm.
about what is the symptoms you think that somebody experiencing some symptoms,
Mhm.
and he has or she has to seek help,
Okay.
mental health, like some no.
Yes. As far as the adults, you would some severe mental illnesses, the person's behavior, external behavior, would probably show that the person is not functioning well. You know, it would be pretty obvious.
That's the severe cases.
That is if you're severe case. Some people with anxiety, it won't necessarily show all the time unless they have panic attack. And some people who are depressed may not show. They're just hurting inside. They may they want to cry, or they're depressed. They may just hold it until they go home, and then, you know, they have this breakdown. Not all illnesses are pretty obvious, but we have to be observant of our close members of the family and see how they function on a daily basis. If you are malfunctioning on a daily basis, if you have, let's say, obsessive compulsive disorder, which is OCD, the short for that is OCD, then you would not sleep at night. You would be cleaning, organizing, counting, washing your hands numerous times, going to make sure the door is closed numerous times. This is malfunctioning. That's obvious to people, and they would notice it and refer them to a professional for counseling or medication. So
you always mention we notice the person suffering. Does that indicate the person who's going through mental illness, they're in denial, or like they're not going to seek help? That's most of the cases.
So two different modules. Some the people who have organic mental illness, like if they have hallucination and they're still reasonable, then they can seek help. They will willingly seek help. People with depression, they're thinking of death all the time, and they're not able to get up and pray and wash and function on a normal basis. They will seek help. People with personality disorder, which is not an organic disorder, it's in the personality, they're usually in denial of their issues, and they think everyone is wrong and I'm right. So they may not seek help. People will have to advise them to seek help.
So that's why the family has the most
To look into it, yes.
What are some consequences do you think could arise when someone doesn't want to seek help, or is just in denial of their mental health?
You could tell them that if the problem is organic, it can get worse. The malfunction in the brain cells, they're already sending different messages, so this will continue to happen until the situation becomes worse. And if you have a personality disorder, if you continue to malfunction, continue to have problems with losing jobs, losing friends, losing family, losing spouses, then all those problems, all those issues and challenges in your life will lead into an organic disorder, and so it will develop into a mental disorder for that person. So there are consequences if you don't get treated as soon as you catch yourself with the illness. Then it would cause more problems. If the teenager, for hallucination, which comes, it's psychosis they call it, for schizophrenia. It usually starts during teenage, and it doesn't. If you're 25, then you missed the cutoff date. You won't be getting it unless some females get it during postpartum, like with hormone involvement. But mostly from teenage to 25, then that's the gap where a person would get to have schizophrenia. So teenagers, once they start getting it, then you would probably want to treat them as soon as possible. Although some doctors have said in some studies that they noticed it before teenage years. Schizophrenia, the child will be acting a little bit off base. So parents have to be very observant. Also observant when when a child reaches 5 years of age, then that's when the child develops not PTSD, but attention deficit disorder, ADHD. So that's when when a child becomes pretty active, not able to sit down, not focused, then we should seek help for that child. So, yes.
So we talk about this, the important part about this too, like we talk about seeking help. What is the causes? So because it depends on how you're going to be treated. So what do you think what is the causes of the mental illness and how you be treated?
Right.
The different causes and how the treatment depend on the causes.
Right. The most important cause for mental illness is the genetics. It's like cholesterol and heart disease, and it all comes in our DNA. And okay, let's suppose now we're talking about the organic mental illness. That's basically genetic. The next reason is when person has like a trauma in their life, or they have a disease like long-term, like a chronic illness, like they're told they have cancer, then they would probably develop some sort of depression, and when the depression becomes severe, then you would develop hallucination or anxiety as a result. And the other thing is, if you have, if people take drugs, then you would have drug-induced hallucination. And of course, trauma develops mental illness as well as personality disorder, in addition to the genetic one.
So the organic one has to be treated obviously with medication.
Yes. Yes.
So there is different the way to treat mental illness, because we want to know, like some people think just you take a medicine, that's it. Depend on the way you treat the medicine. So depend on the cause of the illness. Same like you said, in other organic or physical.
Exactly, because it's organic mental illness. It's a malfunction of the brain cells. So the only thing to treat that is by medication. But we always recommend medication, therapy, and groups. When you go to a group, people understand you, people give you advice, people exchange advice, then you have feedback from your clients, and then you develop also a sense of I'm not alone, So it's medication, therapy, and groups. For personality disorder, it's a little bit difficult. Because they don't think there's anything wrong with them, so they don't really follow up on the medication. They're not always on good terms with their therapists. They leave their therapists, and they fight with everyone around them, especially the borderline personality disorder. This is a very difficult illness that we always have to find. We find it always challenging. And so we find there is a treatment called, it's a group treatment. It's called, oh my God, I'm like blanking on the name of it. But it's a group that teaches you, gives you skills on how to deal with when you feel angry, when you feel like the other person is so bad that you can't stand them. So you begin yelling, how to control your temper, how to understand your illness, and so. That's another important thing for people with disorders.
What would you say are some non-medical ways to not treat, but to help or just control mental illnesses such as depression or anxiety or stress, like mainly for college students or teenagers and stuff like that, who might not want to seek actual treatment,
right?
Want to just try to just
use other
kind of
things.
just
Right.
kind of control their own mental health.
Of course, there is yoga, meditation. For us Muslims, prayer is pretty much like meditation. You focus on what you're doing. When you're facing Allah and you want to pray, you really need to focus. Deep breathing, like mindful deep breathing, is very important. 1,000 to 3,000 milligrams of vitamin C, ginseng, running or just brisk walking. I believe so strongly in helping others. When you give aid to others and you see people smiling, when you feed the hungry, you go to shelters, and it gives you so much reward, and you feel like you are helping others. It's very therapeutic. So I believe strongly in this, in deep meditation and in helping others, and in just sitting and just focusing on yourself, and then of course walking briskly is very important.
So this is the advices you give to people in the community, because as you have a background in Middle East.
Sure.
As you say, like people always not good at taking care of themselves, and this is actually what take us to other levels of depression and anxiety and stuff like that, to the mother and then to the whole house, and to the kids and stuff like that.
Right.
So what is like the general advice you give to people?
Well, just
how to take care of their mental health,
right.
seem like they're taking of
themselves.
Health.
When I was going to school, and all the skills that we learn and material that we take, I always tell my teachers and supervisors at school and now at work, I would tell them my community does not need all of these skills. I have to use different skills, and of course they don't like when you mix like state and church, but I tell them I need to give my community dua for their depression and for their times of need. So I have, al-munjiyat, there are some du'as that I give. I have prints of them a lot, so I give to all my clients. I tell them to read the Quran out loud, and I tell them to contribute to themselves by more focusing on their prayers and on their meditation and their and then helping their community. I don't adhere to everything that I learned in school because it's directed towards the Western mentality. So I always have to tweak it for my community. Did I answer your question?
Yeah, actually, pretty much, and the importance also, like, just like to clarify this part, like the importance of self-care. Like
Yes.
some people think that this is selfish. There is there's a thin line between being selfish and self-care. So we need to talk about this, because I notice in our community that's like a cause of a lot of problems.
Right.
The misunderstanding of self-care
Right.
and selfishness.
Well, the parents have plenty of time to take care of themselves before the kids come back from school. So focus on yourself, do yourself a favor, relax, get enough sleep. We cannot help others, we cannot love others unless we love ourselves. And think about or visualize yourself on a plane when those oxygen masks come down. They always tell you to put the mask on yourself before you help your children or your loved ones. That's pretty much the same concept. You really need to give yourself enough care, enough love in order for you to be a provider, a caretaker, or a parent mainly. Yes.
So what are some self-care tips that you can offer us?
Enough sleep, exercise, humor, friendship. Socialization is very important. If we isolate ourselves, we don't learn anything. I think for our Muslim society, this is very important. I think that we all have to learn English.
Yes.
And we have to understand that we have to be part of the society. Children, in order for them not, I'm going to go back to the old question,
Yes.
in order for them to not to be ashamed of us, our parents, they have to see that you are part of this society. You are knowledgeable. You know the ropes of the American society. You are part of this life that we came in. They're not dumb. They know we came here to live a better life. So we show them that better life. We're not going to tell them, oh, these are kafirs and we're not going to do anything like them.
Yeah.
You know, they know we came here for a better life, and everything here is not about kafirs. There's a lot of people in this country are wonderful, humanistic people that we need to learn a lot from. So we pick from them the best things, and we teach them our best things. So we add to this beautiful society our beauty and our essence of our religion and our values, and we learn a lot from them, and we let our children know about that.
Thank you, Moghitha. Thank you so much.
It was my pleasure. I hope it was
Thank
beneficial.
You, yes.
Yeah.
I think you've summarized everything pretty well, and
Thank you.
hopefully it benefits someone in the
Inshallah.
community.
That
Inshallah.
would be wonderful. My pleasure.
Thank you everybody for staying with us, and hopefully this small conversation helped a lot of people answer the questions they've been asking themselves. And thank you for following ICNA CSJ, for ICNA for Social Council for Social Justice, and see you next time.